Hi, everyone. Thank you for joining us tonight. Welcome back to the next Prescription for Long Life CME lecture. We're so happy to have Dr. Malavade join us again this evening. Please follow the prompts on the screen to sign into this virtual event. If you need CME, please make sure you follow these prompts and complete this before tomorrow night to get your CME certificate. I want to thank our partners, Health First, for working with us to put this program together. And I'd like to turn it over to Elizabeth to say a few words.
Thank you, Joanna. Good evening, everyone. My name is Elizabeth Jean Shah. I'm the Assistant Vice President in DSC Provider Education. I am pleased to join you this evening with my colleagues, Joanna Lee and Angela Sullivan from the Planning Committee, and additionally our others serving on the Planning Committee, Doreen from POMA, Nana Chumesi, and Dr. Victor Chang. So again, thank you for joining us for the Prescription for a Long Life series. We're very excited to hear Dr. Kishor Malavade, as he always has, ensures a great presentation. A special thanks to our course directors, Dr. Susan Bean and Dr. Cynthia Pan. And we couldn't have this conference without our colleagues and collaborators at KIPA, Charles B. Wong Health Center, and KIPA, as well as Maimonides Medical Center. I'm very grateful that you all joined us this evening and for all the work you do in the community. And now I turn it over to Dr. Perry Pong, the Medical Director of Education and Training at Charles B. Wong Health Center. Dr. Pong?
Thank you, Dr. Jocks, and for Health First and for sponsoring us. I think that this series is good for the community and good for us. So I want to introduce Dr. Kishor Malavade, Vice Chair and Chief Medical Officer, Department of Population Health at Maimonides Medical Center. So briefly speaking to him, he's been working a lot now on population health and helping to boost the quality performance of members of the IPA and the local community. Also, he is interested in integrating mental health into primary care practices. In his spare time, he also oversees the IPA. And in his other spare time, he does still work in the emergency room as a psychiatrist. So he has many other accolades and long history. I just say we're glad to have him here, and that hopefully he's able to shed more light on mental wellness.
Thank you so much. Thanks so much, everybody. And thank you, Dr. Pong, and to all at Health First and at CAMS. Really appreciate coming back to join you all. And when this topic was broached to me, I of course, immediately went back to, in my mind, to having given a talk a few years back on provider burnout. And in many ways, this is the flip side of the coin. Although this topic, mental health and wellness, and as I've titled it, caring for your emotional, psychological, and social well-being, much like the burnout talk, it was about how do you deliver care as a provider and avoid and ways to avoid burning out, but this is ways for you to stay healthy. So we're going to talk about it from a positive perspective. But it's, of course, this is something that different from the provider burnout talk that was very much focused for you all. Of course, your patients, your staff that work with you, colleagues, all benefit from you doing things to avoid burning out. But it was really focused for you all. Whereas mental health and wellness is something that clearly is important for you. And it's the positive side, as I've said, of how a provider can focus on themselves. But this is also about things that you can do with your patients and staff. And so this is a bit of a talk to, as part of the Prescription for Long Life, ways to care for yourself and ways to help your patients care for themselves. And I'm really going to start at, some important kind of overview and put this in a at a very high level global perspective. And then I'm going to come down later and talk about it in a much more practical way, and how it affects you all and how you can tips for you to address these issues in your practice in your daily life. Next slide, please. I do want to make sure I go through, again, just some of the purpose and objectives. I've just mentioned the purpose, but in terms of the objectives, to describe what concepts of mental wellness and emotional well-being, what those really mean, and other associated terms. Recognize the difference between these concepts and mental disorders. And so I'm going to talk a bit about mental wellness and mental health, and mental disorders. And they are related concepts, of course, but very distinct. And it is important that we can distinguish those. Appreciate the impact of mental well-being in your personal professional life, as I've just mentioned. But really to start to recognize what are some of the effective strategies. So I'll talk through some of those further on in the talk, about some of those practical and effective strategies for addressing wellness. Certainly, it's important for you to recognize when, the signs of where, mental wellness is not present, is absent in your patients and your colleagues, obviously, most importantly as well, in yourselves. And that, of course, ties to some of the burnout that I've talked about in the past. Educate patients about the importance of mental wellness. And this is, something it's going to be part of some of my overview and that global perspective that I'm going to bring to start out in the background. But why is it important for everyone and, and the population you care for, and how to incorporate those concepts and some of the actions to achieve improved mental wellness into your practice and personal life. I have no financial disclosures to talking about wellness, other than being a psychiatrist who wants to see people do well. Next slide, please. So, in the vein of my prior talk, I have included a few slides from my prior talk on burnout. This was one when I was going through the slides, given the relatedness of the topics. Of course, I thought it was a good one to continue to keep in this set. And again, that's also an important lesson about wellness, right, and health. If there are things that you can use that you've used before and they've worked, keep using them. Don't reinvent things. So, again, the doctor will see you now, Ms. Perkins. Please try not to upset him. This was, of course, related to burnout, but this is really also a topic that's important as we think about wellness, and how one is doing as a physician, in terms of, again, as I talked before, avoiding burnout, but staying well. So let's hope that this isn't what any staff in any of your practices need to tell your patients. Next slide, please. So in terms of, and again, this is just to give an overview of where we're going to go tonight. Again, really key definitions and concepts around mental health and wellness. And I'm going to take us through, again, some broad, more global perspectives that are beyond mental health. It fits into the larger health world, but gets into even, the sustainable development goals from the UN that were propagated and ratified in 2015, that were set for 2030. And I'll go through that and some of the World Health Organization's work on mental health and wellness, and how they have really tried to shift things in terms of how we think of healthcare, but not just for public health. And in that sense, I'm going to get into, then dive in as we come a little more into the mental health world, into the global mental health space, which is focused on, I would argue, population mental health. And it's not, and what it's of course very much focused on public mental health, and some of the leaders in that work in this country, but around Vikram Patel at Harvard, at Public School of Health, but others who have been around the globe in all continents have been working together. And I'm going to talk through some of the work that not only World Health Organization has done, but then Lancet Commission on mental health, on global mental health, really has outlined a number of key concepts here, and to help us understand, give us some background. Why are these things important? What is the burden of illness and mental health, and mental disorders and mental illness in our population? What are the things we've been doing to address them? I haven't really talked with you all about, I think, formal mental health conditions. It's been the broader topics of burnout and loss and isolation. And I think it's important because where I'm going to go with this talk is that, we're moving in a direction that is away from thinking of terms in terms of health, in terms of binary concepts of mental wellness and mental disorder, and just thinking in terms of disease, but to really thinking more along the what is a spectrum of from mental well-being and health to clinical disorders that we see, and how do those concepts shift how we think about treatment? And so, in the global mental health world, there is a lot of work around clearly public mental health initiatives that should happen. And I'll mention some of those as we go along, but making sure that we're focused on you all as providers, beyond the public health initiatives and directives. What are the things that really fit into your work? And that's why I say, as providers, you are providing direct care, but also thinking about your population. And this is the shift. Dr. Pong and I were just talking about this, the shift of, how do we start moving things to more quality and value, and again, what's best for our patients that we treat, but also for the overall population that we treat. And as there are shifting, you are, I think, all probably involved in some value-based arrangement of care. So as we think about incentives to improve quality, and obviously some of those are financial incentives that have to shift for us to focus on overall well-being and health promotion and disease prevention, rather than just treatment of conditions, right? And there are compelling arguments to do that. There are compelling arguments in the mental health world for that. And so I'll get into that bigger picture and really some of the determinants of mental health and wellness. So we have an abundance of research now on what are the social determinants of health. You all have been hearing about social determinants of health. There are also clearly social determinants and structural determinants of mental health and wellness. And so I'll get into some of those. And then, after looking at it from a big perspective, and thinking about, not only how countries and, all countries can think about doing this work better, and what are the shifts that have to happen at the care delivery level as well as in the public health space. We'll bring it back down to where you all are on a day-to-day level, and talk about some of those strategies to improve emotional wellness. And again, for your patients, tips that you can talk to your patients about, but obviously, hopefully, as we say, hopefully you'll take those into heart and think about them and reflect on how they may be helpful for you as well. So next slide, please. So I will start with this again, as I said, really a global perspective here and background. This is the Constitution of the World Health Organization's definition of health. Health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. This may seem like an obvious statement to you all. It's an important statement. It's one of the first times in terms of definitions of health, from the World Health Organization and their constitution, that mental and social well-being are included in that. Hopefully that's not a, not a surprise to you all, but it really was a shift in terms of thinking about health and mental health. Next slide, please. So when we talk about mental health, we are, again, and I will really make this point a number of times, but we're not just talking about the absence of mental illness. And obviously, I think you're familiar, and we all have, and it's not just in the West, it's been a healthcare issue, but certainly more prominent in the West, where we've focused on disease and illness at the center of healthcare. And it has been increasingly in the global health space, and which is also in the population health space, that health and wellness are distinct but related concepts to illness and disease, and that we really have to kind of consider the overall focus, and we really start to think more about the continuum of promotion of health and prevention of disease towards the treatment of disorders, and then facilitating recovery, recognizing that it's not just a situation of there are illnesses, I can identify them and they can be treated. This really, and the reasons I'll get into as to why it's important that we move beyond that. It's not to discount the importance of treatment, where we can treat them, but it really gets at the allocation of resources that we have, and what's needed to treat mental disorders, and to facilitate recovery, and the shortage of specialized resources, not only, of course, globally, but I think you all have experienced this even in Brooklyn and Queens and New York City, and Manhattan, and if there are people with resources can get access to care, but for our broader population, access to specialty mental health is challenging and often just not available, and that's in New York City, around the country, and so I'll talk a little bit about how some of our resource issues really help us and push us to think about promotion of health and prevention of disease beyond just treating disorders. And mental health is, again, as I mentioned, having talked to you all about burnout in the past, they exist on the opposite ends of a continuum, right? Of being a healthy provider and a burned out provider. And so I'm going to, again, in the interest of tying things together, I've kept a couple of slides, and from my prior talk on burnout, that I've included here as they pertain to this topic. And I will get into the more details of those components of wellness that mitigate and prevent burnout, of course, but also just are things that are good for you to be able to teach your patients, talk to them, or have staff talk to them, that are part of your team, so that you can promote a healthier life for your population that you serve. Next slide, please. So I mentioned, the constitution of the World Health Organization's definition, and I mentioned the UN Sustainable Development Goals from 2015. I'll come back to those, but these are some definitions from World Health Organization's Comprehensive Mental Health Action Plan that was set out in 2012, and really was building on and is a plan for to go through 2030. And it's useful to understand and think about what they're talking about here. And so, again, mental health is conceptualized as a state of well-being in which the individual realizes his or her own abilities, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her community. And then with respect to children, there's an emphasis is placed on the developmental aspects, for instance, having a positive sense of identity, the ability to manage thoughts, emotions, as well as to build social relationships, and the aptitude to learn and to acquire an education, ultimately enabling their full active participation in society. So really we are getting here, and at what the World Health Organization is getting at is, what are the necessary components to be active and productive members of society, to cope with difficulties, and again with children. And I'll come back to some of the interventions that have been put into action to help get us there and help build healthier populations and communities. But it's important to understand this framework. I think as you hear this and read it, it's not a lot about disease here, right? It's not about mental disorders. There's a lot to think about and a lot for us to do in that regard. But again, I'll come back to this is really about how do we start just building healthier communities and individuals and help them achieve not only in their goals in life and feeling productive, but the importance of needing to do this early in life, and we'll come back to why those development is such an important marker for us to think about as we think about health promotion and disease prevention. Next slide, please. So these were in 2015, the UN Sustainable Development Goals that built on the Millennium Development Goals that ended in the early 2000s. And they were the successor that really kind of took things to a different level in terms of how the UN and the world was thinking about health. And as you'll see here, number 3 in these 17 Sustainable Development Goals, which were all about, again, stepping back, the Millennium Development Goals were about how do we eradicate poverty and how do we do things that will, eliminate an important barrier to sustainability. These were really now articulating what are the things we need to do to have a healthier globe and healthier populations and communities in all nations. So really, these were about not just focusing around where is there poverty and significant poverty and what do we need to do about that. These were things that were going to be more important for everyone across the globe. All nations are implicated. And of course, we know that high, income, countries may be more successful in a number of things than low and middle income countries. But the reality when it comes to health and mental health is that when you really look at it, there are not really significant differences in outcomes in high income countries, and certainly not in this country. But the disparities that exist economically between low, middle, and high income countries around mental health just kind of eradicates some of those disparities in some ways. And I'll get into a little bit of that. But what is important here is that in that third goal of good health and well-being, they really called out the need to really address mental health and well-being as part of the goals. And some of the sub-goals under this third goal of good health and well-being really called out mental disorders, alcohol use, tobacco use, and suicidality as important targets by 2030 to really start to target. But I'm not going to get into all the details of what they were promoting here, but it was really just to recognize that the UN was calling this out, and many in the healthcare world and some of the research that's driving this are calling out how mental health is important for productivity, sustainability, the economic impact of overall disease and health, but mental health in particular. And I think that's a shift in paradigm that's happened in the 21st century and these last 10, 20 years now, and that has become part of the culture that, wellness and well-being are essential, that are not just given things, and it's like we're just born being well. We all know life in this world is complicated politically, economically, socially, environmentally, in terms of the climate, and with the increasing number of disasters that are putting people in vulnerable situations. Their wellness and resiliency are tested, and it's important that we do things to help build the resilience and wellness. And so this was, again, a really important shift globally, and really thinking about the sustainability of societies in our world, and how, again, all these goals, 17 goals, are important, but number 3 here was a really important one. Next slide, please. So, in terms of thinking about reframing mental health, there were 3 key principles that the Lancet Commission from 2018 on global mental health and sustainable development called out. And these are, that there needed to be a more staged approach to understanding and responding to mental health problems, as opposed to the binary approach of current classifications. And I'll get into more of that. But that staged approach is an important conceptually. And I'm going to talk a little bit about what are the things we've been doing in terms of population health in Brooklyn and in the US and elsewhere to address some of that. But some of these things are actually happening locally. Reconciling this nurture versus nature debates, and really converging the findings of social and biological determinants of mental health problems with a life course trajectory that really accounts for neurodevelopmental processes. People to the old, analytic world and early biological psychiatric mental health world was focused on, nature versus nurture. And the reality is both things are important. And we have increasing understanding of how nature impacts and is affected by the environment and experience, not only in utero, of course, but then in early childhood and development. And I'll talk about some of those things. And then, recognizing mental health as a fundamental human right for all people, in particular for people whose mental health is at risk or is already impaired. And so I think there's a bigger talk than what I am prepared to do here, which is, to really focus on that issue of the fundamental human right. We can, potentially debate and disagree about how important those things are, and whether we truly value that as a fundamental human right. And how, when we recognize, though, the stigma that still exists for people who are at risk for mental health disorders, but who are already, experiencing mental disorders, it is important to recognize this issue of rights and disability become a little bit more sharply focused. And as I say, there's a whole lot that I could go into there, but I'm not going to focus on that issue so much. But I will weave in some of the treatment needs for that population, and how we can shift, and how this reframing of mental health and these principles do shift how we think about public mental health, but also, again, at the practice level, what we can do and where we should be doing and providing care. So next slide, please. These are important innovations that have been happening in global mental health, that I think I certainly will talk about some of these more. So, and this fits part of that shifting of a staged approach and the paradigm shift in mental health care. And this first one is an important one, and I'll get into more of that. Task sharing as a concept is an important one that really started globally, was brought to the United States, and certainly in Western Europe, but in the US, was brought here, this concept of task sharing. And we were implementing this in New York City in the mid 2015 through 2020, with the support of the Department of Health and Mental Health and the Executive Deputy Commissioner of Mental Health at the time, who had been working with the UN on the Millennium Development Goals and then the UN's Sustainable Development Goals afterwards. And he was very well aware of these things. Gary Belkin had really tried to bring this more foundational approach to how we think about mental health. And task shifting is and sharing is an important one. Really addresses a few things. How do we address the right issues in the right space with the right people? But an important part of what task sharing does is really addresses the challenges we have in terms of a mental health workforce. And it really tackles and challenges the notion that everyone with a mental health problem needs a mental health specialist. And so I'm going to go into this a little bit more, but I'm going to share a story. When I was going around, when we were forming the network, the clinical network under Community Care Brooklyn, which some of you may have been participating with us under the DSRIP waiver with New York State and CMS. I talked to, and I went to a practice, a primary care doc in central New York, around Crown Heights, and I was told that it was malpractice for a primary care doctor to prescribe antidepressants. And I'm chuckling now. Hopefully I'm making some of you chuckle, although again, I will be respectful of the fact that that has not been the way things have been for a lot of PCPs. But what maybe some of you do know is that in terms of the mental health world and for the diagnoses of depression and anxiety, but particularly for depression, 60% of the antidepressants prescribed in the United States are prescribed by PCPs, not mental health specialists. And it's simply just a matter of access and volume and supply, right? There is not a supply of mental health providers to do all the work, but this really gets at a larger issue, which is when we start to see foundational mental health as part of overall health, there are certain parts of it that should and can fit into the primary care space, obviously with supports and resources for the PCPs. And I am very mindful of talking about bringing up things that as a psychiatrist that a primary care doctor can do and or should do when you all do far more than all of us do in healthcare. I have a really great respect for primary care as being the foundation of our healthcare system. And frankly, there are not enough resources, and there are ways to do that. We just haven't provided them necessarily and or provide funding for some of those resources. But the issue is, it's still, if you think about, and I give the example of hypertension and as a basic thing. Does every patient with hypertension need to go see a cardiologist when they're first diagnosed? I think most of you would agree, probably not. There may be compelling reasons for some to, based on other risk factors, disease development, et cetera. But generally we try to manage those, and when things bubble up, we go to specialty care. So a bigger component here of how we think about mental health and mental wellness is what are the appropriate things for a primary care setting, provided, again, the resources are there, but can we really think about how we incorporate that into that world, much as we do with other specialty care, and then use that specialty care in an effective way that balances things. And so, as I mentioned in the second point here, coordination of this foundation with primary and specialist care to achieve a balanced model of care is really essential. And then, again, a little bit too, but not too much, into the adoption of digital platforms. They're there, you've probably seen some of these. Obviously, a lot of companies are marketing these, but whether they're texting apps, other apps that can help people with achieving wellness and doing specific things to address their wellness, I think there's a lot of use. There's obviously a lot of digital technology that will help us with disease management and other issues, but in thinking about how we can better serve the overall health of our and mental health of our population, we need to think about adopting some of these tools, and they're available to our patients and at a community level. And then lastly, just implementation of community-based interventions. And again, this relates a lot to number one, but there are ways to involve the community in care that isn't trying to get care, to be delivered at a community level by non-clinicians. Of course, that is not really possible, and nor should it be. But it speaks to, as I talked about, the non-binary thing of mental illness and mental wellness. Just because you don't have an illness doesn't mean you're well. That's the simplest way to put it, right? There's a lot of things we can do to help people being well and avoid getting ill that can happen at a community level, and it's where our population is at. I mean, they're coming to us when they have problems, and we are seeing them with full-blown disorders, but they're touching the community organizations, especially I'm speaking largely to the Medicaid population too in Brooklyn. They're touching community and social service agencies, and there's a real opportunity for us to increase the ability of our communities to do things to help individuals, families, and communities that don't involve us. So again, it behooves us, given, and I know for the PCPs here, the more we can, spread out and expand the workforce to address mental health issues and mental wellness, it serves us all well, because we certainly cannot I can't sit here and talk to you about how this is all going to be solved by primary care. Next slide, please. So, in terms of that, these key terms that have been defined in the mental wellness and emotional wellness, mental health space, these are some of the important definitions that we, have been propagated. And again, some may seem kind of obvious, but I'm just going to go through them so that we have a shared understanding of what we are talking about, and that we'll get into. There's a number of other terms I'm going to get to afterwards, but these are some foundational terms in the mental health space. So next slide, please. Right. So when we talk about happiness, and it sounds like a campy kind of silly term, but it's an important one, right? And I'm going to talk about it more seriously, which is the subjective satisfaction with life that incorporates both not only your emotional experience of feeling good, experiencing pleasure, what we refer to as the hedonic tradition of feeling good about oneself, but really happiness incorporates the perception of living a meaningful and good life. The eudaimonic tradition, this is developed by Aristotle way back, that there's something more to, it's not just about hedonism, right? That there's something that makes us happy from having meaningfulness and feeling that we are living a good life. And I think, most of us would agree, and physicians definitely. This is how, happiness is usually thought of as that hedonic kind of thing, and just being happy and feeling pleasure. But it's really more about this meaningfulness and a good life, and that can we balance those, and that do we look at success, in individually and as a society, if we can meet these needs. Next slide. Well-being is just that subjective evaluation of your life satisfaction. There are broader definitions, and they are less subjective, and they consider social and personal circumstances. that, this is something that you can't really define for everyone, right? Everyone will define their own, second. Yes, good. Thank you, Dr. Pond. How do they define this? And that's, this comes back to, and I'm going to get to this again in terms of treatment and what we think of as shared decision making, an important concept in healthcare. Talk to your patients and ask them what do these terms mean to them, right? Next slide. Quality of life is a person's perception of their position in life in the context of their culture, their value systems in which they live in relation to their goals, expectations, standards, and concerns. So again, quality of life is it's a subjective perception and experience from an individual. Next slide. Mental health, I think, again, the broad topic we've been talking about, but making it a little bit more definitional, the capacity of thought, emotion, and behavior that enables every individual to realize their own potential in relation to their developmental stage, to cope with the normal stresses of life, to study or work productively or fruitfully, and to contribute to their community. As these were from the World Health Organization definition, but have been, brought together from the larger global mental health space. And again, these don't really talk to disease, right? They talked about things that help us live our lives and cope. Next slide. We're all familiar with this to some degree, and obviously me more so, disturbances of thought, emotion, behavior, and relationships with others that lead to substantial suffering and functional impairment. And functional impairment is a key concept that has developed over time. And I don't have time to get into all of those, but I'll talk a little bit about it. In one or more major life activities as identified in the major classification systems, ICD-10, DSM-5, the TR version, but it was in the prior. It was actually in DSM-4 that functional impairment was added. It was partly from broad national surveys that were done that used high school students going door to door, reading off symptoms to patients. And again, people said, sure, I'm depressed, I have anxiety. What they were talking about is stress and feeling sad, or that no one had bothered to ask, oh, does your sadness and or stress or anxiety impact your life? And when they narrowed down on those, of course, we realized that the number of people identified with clinical disorders in those surveys was way off and was overestimating the burden of depression and anxiety disorders, when what they were talking about were really, things that were, part of their experience of life and stress, but that were not impacting their life. Next slide. Social suffering is the ways in which subjective components of distress are rooted in our social situations and conditioned by cultural circumstance. And I think this speaks to some of the broader ways that can impact mental health and well-being. And I'll get into those a little bit in terms of the determinants of health. Next slide. Psychosocial disability really refers to, again, coming back to the disorder side of things, how, there's disability associated with impairments related to mental disorders, and they do limit the ability to participate fully in life, in social and community life. And so these are the, real impacts of untreated illness. And then, what happens when we do have treatment resistant, treatment refractory conditions, and we need to really be focused in very different ways on how to help them. And of course, this is not the population. I'm talking to you about how you can address some of this, other than making sure they're connected to resources. But they really come about. And mental disorders and psychosocial disability come about because of the way mental health conditions and mental disorders can really prevent full participation of individuals in society, not only from stigma, but from the real cognitive impacts of the disorders that we have. So next slide. And recovery, that's an important, again, another one of these that really is defined from the person's, perspective, what it means. Of course, some of the major parts of what we think of as recovery in mental health is gaining and retaining hope, understanding of one's abilities and disabilities, having ability to reflect and appreciate what I can do and what I can't do. But often recovery means re-engaging and engaging in an active life. Personal autonomy, social identity, meaning and purpose in life, a positive sense of self. But it's really defined by the person themselves. It can't be something that we tell them what recovery means. Recovery is what the person, believes to be important to themselves. But I think hopefully we can all identify with what we think of as recovery, because historically in the mental health world, and to give you the example of what success is with a clinical trial with an antidepressant, an antipsychotic, a mood stabilizer, it's a 50% reduction in symptoms, okay, from initiation of care. 50% of reduction in symptoms can still mean a lot of symptoms, right? And it doesn't mean someone, and I think that's been a big shift in the mental health world, not just in the global world, but in the mental health world more broadly, is understanding that the concept of recovery is really key. Treating someone's illness and getting them better needs to lead to these things that we're talking about. If we're not getting someone there, then they're not really, have we had the impact that we can and that we should. So next slide. And resilience, an important concept. And I will get more into this one as we get into the more details, how we bring this back down to the level of what you're doing. It's the capacity of individuals to adapt to adversity or stress, including the capacity to cope with future negative events. It can be seen at a community level. We see resilience being demonstrated at a community level, but it's really an important factor contributing to the relatively low proportion of people in emergencies who develop long-term mental health disorders. So resilience is one of those key factors that I will highlight as we go through what are the things that help us stay well. And we see this as there's been a lot of research now showing how these are really, this is a really critical concept, and it will be the primary one I get into and we get into the effective strategies for coping and dealing with your mental health and well-being. So next slide. So when we think about determinants of mental health, what we're thinking about is what are the social and economic factors, and really there are a number of there are important, beyond just social and economic, there are environmental factors, there's neighborhood factors that impact, and biological factors, determinants. But in terms of the social and economic factors, income level, employment status, educational level, material standard of living, these are all important things that we know are correlated now from numerous studies over the last couple of decades now that show how especially income and employment and educational status really do impact mental health, and are strongly associated with depression, anxiety, and mental disorders more broadly. Physical health status, of course, does also, we know, impacts mental wellness, but family cohesion, again, even in the smaller social circle, being isolated can contribute to mental health conditions, discrimination, violation of human rights. We, of course, understand to be leading to stress and clinical disorders, whether it's an acute stress disorder, post-traumatic stress disorder, anxiety disorders, depression. Many of those go hand in hand with discrimination and certainly violation of human rights and violence. But exposure to adverse life events, particularly in childhood and adolescence, are strong indicators. And there's been a lot of, again, research demonstrating that these are important factors for us to think about. So when we recognize that we have these determinants, the question is, what can we do to address them? And again, these are beyond our level of what we can do in some respects, right? They're governmental, they are societal, they're, in this country at the state, city, community level interventions that can address some of these determinants, broader social and economic factors, structural factors. But there are things we can do in the healthcare space to start to address some of this, or at least mitigate some of this. Next slide, please. So, and then there are, of course, the intrinsic factors, one's social and emotional skills. We all, and I think many of us think about health and mental health as really being this, right? Like, and again, it's some failing deficiency in these skills that leads to mental disorders. Well, there's some truth to the fact that there are things that we have within our, what we think of as social and emotional skills, emotional quotient, social quotient, adversity quotient is a more recent quotient that's been described in addition to IQ. Clearly, some people just have that ability, natural ability to be more resilient. Others do not have those social and emotional skills that help them build resilience. But it's important to recognize that there are some of these things one can do to foster. It's not just you have it or you don't. And again, really experience in early life really does impact a number of these things in terms of the developmental process. Next slide, please. So, I've framed out some of, the bigger picture here. When we think about that reframing of illness and disease as being on a continuum from health to ill health, there's clearly a broader public and population health perspective. But what I describe in that final bullet is really how we start to think about disorders and mental health to mental disorder. That, in fact, when you break it down, there are a number of steps along that continuum and that staging of care, and they have implications for how we address things. So there's mental health, there's people who are asymptomatic and at risk for problems. There are people who experience mental distress, but don't have clinical disorders. There's subsyndromal symptoms that people experience that we're aware of. And then there are full-blown mental disorders. And really, we have, focused the healthcare delivery system on mental disorders at the end, without really looking at the upstream things, and certainly not thinking about what are the things that help promote mental health and prevent mental disorders. So, these are the important things that we need to think about. And, I will say that there are important pieces of, again, as I mentioned, things that we would do to address things upstream from the mental disorders. And a lot of it is about how we can, at a community level, start thinking about building out resources with staff who are interacting, whether it's at social service agencies, community agencies, to look at that asymptomatic at-risk group. And some of it is just public health things, how we can, help people understand ways of coping, building resilience. These are not things that have to happen at a practice level. But if you have the time and you can do these are important things to help promote well-being and health, and there's good reasons to. There was a good study in British Journal of Psychiatry, I think in 2015, that identified subsyndromal anxiety and depression, not full-blown disorders, had significant impact on the healthcare disease burden and costs in the population, more so than full-blown mental disorders. So, and that's something we are aware of even with clinical depression and anxiety, that the costs of the disease are coming from not simply the impact of the disorders, but the downstream effects they have on one's physical health and well-being, and overall healthcare. So it's important for us to start thinking about interventions we can do earlier in this process. And they often involve, again, the concepts that I talked about: task sharing, community level interventions, and then, of course, starting to be able to do more with supports in the primary care setting with mental health backup, knowing how you can then get people who have a mental health issue. If you're initiating care, how do I make sure I get them to that specialist when they really need that, because they're not progressing in terms of their care with us? Next slide, please. So, as I mentioned, some of these strategies are much broader than the things we would do, but I wanted to, share some of the things. I mean, clearly, some of what we can do at a public health level and at a governmental level: anti-discrimination laws, information campaigns, promoting the rights, opportunities, and care of individuals with mental disorders. Those are important things, and they have been happening. I will say, an example of some of the work. There's a lot of mental health advocacy work that's, of course, promoted the rights and opportunities in care, and it focused things, helped shift the larger healthcare world to thinking about recovery more than just treatment of symptoms. But I'm going to mention a project we worked on, and again, as I mentioned, with Gary Belkin and the Department of Health. This was an effort that was built out in LA, in South Central LA and East Hollywood, two largely Black and Hispanic communities that really had a very low rate of seeking mental health care. And so, there was a recognition after talking with the communities, and again, this is no news to any of us. I see it in every community, just to varying degrees. There's huge stigma around mental health. The belief that it's weakness, it doesn't exist. Various things get said, and so what folks at UCLA decided to do, which was different, was to say, look, let's partner in care. They called it the CPIC, Community Partners in Care. They look to talk with and really learn about, if we're going to address this, it's got to come from your perspective. So as we've talked about, the patient's perspective is key. We think about patient experience more formally now. But when we think about what is their perspective, the folks at UCLA really started to even redefine the terms. If you don't want to call it depression, what do you call it in your community? What's going to get someone to come in to get help? And also what they did was they trained up a number of community organizations, but also they recognized religious institutions were trusted resources. They really went to the trusted resources in the community and provided them with skills to identify, recognize, talk through some care for individuals who were presenting to them, and then to connect to clinical care when that was needed. What they did do was a randomized trial with support from the RAND Corporation, and they looked at this model versus the standard of care, where someone was screened for depression and referred to care. And what they found was that there were significant improvements, not only in reduction in ER visits and hospitalizations in the population compared to the standard usual care of just referral to mental health provider, but they found even more important things. I mean, more important, ER utilization and hospitalization are important, but reductions in homelessness. So it speaks to some of the issues around how mental health can impact one's overall well-being and recovery, and ability to live in a productive way. And so this was a powerful model. We decided to adapt it here in Brooklyn, recognizing that no one neighborhood is, I mean, every neighborhood in New York is so diverse. We really didn't do it in a neighborhood. We focused on a population that was experiencing a lot of stigma and was avoiding health care. And it was in 2016, 2017, at the time that the Trump administration was saying that people who might be here illegally might be deported, and if you touched public agencies, were potentially going to you might get roped in, and so we knew we were hearing from our partners in the community that people were avoiding even primary care at the time. And so we thought, and most importantly, in the Muslim, in the South Asian, and the Islamic communities. And so we decided to do an anti-stigma and health promotion effort with about 20 community agencies in Brooklyn, and that ended up extending into the Queens. But really to just try to recognizing that, again, these were communities that were going to go to their trusted resources. We went to imams, we spoke with imams and we got them to agree to do on their Friday speeches to be able to talk a little bit about mental health and why it's important. Not everyone was willing to go along with that and engage, but we had a number of imams who were willing to do that. And again, these are the kind of things we can do at a community level to help address promotion and prevention. So that is just one example of things that we can do, but other important things here: nurturing of core individual attributes in the formative stages of life, early childhood programs, life skills and sexuality education, but life skills, and really, how do we support the development of safe, stable, nurturing relationships between children, their parents, and caregivers? So there's a number of programs that are happening in healthcare and pediatrics, in coordination at the first postpartum visit and first child visit. It's a program called Healthy Steps that was developed to really start looking at the mother and child in that interaction, and really was focused on the mother to see, are there any issues here that are impacting the mother's well-being and health, recognizing that if the mother was having health problems, mental health problems, the child was going to have those, and was at greater risk. And so there are a number of programs where we can start doing things to address things earlier than we would normally do typically in healthcare. And Healthy Steps has been, again, a validated model that's now promoted by the federal government and SAMHSA, and is encouraged to be integrated into pediatric practices. We are doing that at Maimonides in our pediatric clinics. But we also do collaborative care, and I actually do directly support our pediatric collaborative care program at Maimonides. And one of the things we really wanted to focus on was, and as I talked about before, the non-binary approach to disorders and well-being. What we were seeing in the population as the pediatricians were screening kids was that they just had a range of, again, subsyndromal distress, and they were around real life issues, right? So we have a large immigrant population, immigrants who, kids who are dealing with how to straddle the old world and new world. Parents who have dealt with so much on their own and have experienced trauma in their old countries, in the new country, kids with similarly having those issues, and parents not knowing what to do as a parent. How do I talk to my kid about these things? What am I supposed to say and what am I supposed to do? A lot of the work that our social worker in pediatrics is doing is a lot of basic parent education and support, adolescent education and support, teaching coping skills, Most of the kids do not have any clinical disorders of major depressive disorder, any type of formal depression, no formal anxiety disorders, but they're struggling. They're struggling in school. They're struggling to fit in socially. It's impacting them, and we're able to do work on some of these more core issues to address wellness. And I think that it's been really enlightening to me to see that happening in the real world. And I will say this, this is coming in the context of what's been described as post-pandemic, a mental health crisis, and certainly an child and adolescent mental health crisis. And I can say from working in the ER, there are real serious problems that adolescents are going through, but most of the kids we are seeing in the pediatrics clinics at Maimonides are not people that would ever be referred to a child mental health service. And frankly, their parents would never bring them, and not simply for stigma reasons. They don't need that level of support. They needed some support to really talk about promoting well-being, coping, resilience, how to deal with loss. These are things that no one's talking to them about. So, again, and I don't expect the pediatricians or any PCP to have the time to do all this work, but they need resources and support to help them do this. Next slide, please. Right. So we pivot now. I'm going to pivot to some of the more focused things around, what are the things we know? And I think we have doing okay on time. We've got 20 minutes. All right. So this is something I included from my prior talk on burnout, because I thought it was relevant very much to this, right? And it's, the flip side of burnout is engagement, right? So it's an energetic state of involvement with personal fulfilling activities that enhances one's sense of professional efficacy, wellness, and resilience, of course. Things that we think of when we think of someone who's engaged, right? So, it involves having energy, being involved, feeling that, you can be efficacious at what you're doing. You have meaning there. Next slide. And this is the continuum of professional wellness, but it's overall. These are things that, are really, as we think about it in terms of a spectrum, there's that spectrum from, exhaustion to having energy, from being cynical to being involved, to feeling like you can't accomplish things, to feeling like, hey, I have efficacy, I can do things. We all fall somewhere in the middle here, hopefully. Unfortunately, some of us really fall on the exhaustion, cynicism, and inefficacy side, and that's someone who's experiencing burnout. But when we think about that other side of having that energy, that involvement, that feeling of engagement, those are the things we're working towards. Next slide. And, these are things that have, again, in terms of, I'm talking about burnout here and that can promote wellness, but it's finding value in your work. There are a number of studies that have demonstrated that, that burnout is less likely in physicians who find that value in what they do. And, this 20% physicians who spend less than 20% of time on activities that they find meaningful have a higher risk of burnout. These are real issues that you need to be meaningfully engaged. And so there are intrinsic and external motivators. And, the intrinsic ones, though, in terms of studies, have been found to be more influential on career and life satisfaction than external ones, income and work hours. And work hours are important, of course, and income to survive is important. But the things that really help us feel better, healthier, more emotionally well are those intrinsic ones: the commitment to patient care, commitment to the practice of medicine, the overall meaning of life for us. That really gets to some of those eudaimonic senses and that eudaimonic tradition of happiness, meaning, how do we find value and meaning in life, right? So self-awareness and mindfulness are also really important factors in having a positive impact on burnout, but on wellness. Next slide. So when we get into these things, the things that help drive us to being well, they can really focus on, and that's the remainder of this talk is going to focus on, is practical things you can do, and or are what we see as essential to that sense of well-being and emotional well-being, mental health, strong social networks, and strengthening social connections. I mean, we know it intuitively in some ways. We've all experienced it. What I will say is, for those, as a mental health professional, it's these kind of things that mental disorders like depression really, and most mental disorders, but depression in particular, it can be so insidious in that it isolates you. It pulls you away from the things that are going to help you. And so, but we all get caught up in that, whether we're too busy, we're caught up in work, family things going on, and we don't really focus on strengthening those social connections. So they can really not only prevent burnout, but again, they are very well, and there are numerous studies now showing how wellness, overall wellness, not just for physicians, but for people, depend on having stronger social connections. And that physicians certainly have reporting close relationships at home and at work, definitely have, in terms of studies, have been shown to report feeling subjectively happier than those that do not. So, I'll mention, I mentioned these in my prior talk. I'm not going to get into some of the interventions on an individual and organizational level. I've gotten there before. So next slide, please. So what are the things, again, just practical things you can do yourselves and you can talk to your patients about. And so it's really making connections, right? It's taking care of yourself while caring for others. It's an important part of, that's an important thing for you all, and it's an important thing for your patients who are caregivers, right? They're dealing with family members who have chronic disease, who are elderly, who may be dealing with cognitive disorders. There's a lot of caregiver giving burden, and it can really impact everyone. So even when you are caring for others, thinking about, how you need to take care of yourself and make time for yourself is important. Be active together with people is an important part of how we, can have stronger social bonds, not just being together, but doing things together actively, whether it's physical activity, going, something that stimulates the mind, going somewhere to a museum, some things that really, like, to be active with people, whether it's family, friends, can be really important. Shaping, healthy habits in a family, your family, your patients, and how they can do that, spending more time with family, bonding with family. These are important things as we think about strengthening social connections and building healthy relationships where we can. Next slide. Resilience. We've talked about it. I've talked about it a bit. It's that ability to return to baseline after stressful events, the ability to cope. There's numerous studies showing that, again, but it's still an emerging field of research to understand what are the factors that help us build this resilience, but it helps us deal with challenges because we're always going to have them. And again, we cannot, even when we think from a public health perspective, yes, we can try to reduce the impact of wars and economic disruptions to people's lives and climate change and natural disasters that challenge people and put people under stress. But some of these are just like normal stresses, right? And natural stresses, loss, grief, broken relationships, people, even just for kids growing up, you go different ways from, whether it's college or jobs or things that pull people apart. So how do people cope with those challenges and build resilience? And it's associated with optimism, hope, and honesty. It's not necessarily hardwired. I mean, we think about it as that some are more, have it and some don't. But they are things that can be developed and worked on. And factors that are associated with resilience, of course, are job satisfaction, use of wellness strategies. So that's important, right? So people aren't just, they may have the capability, and this is something we understand in psychotherapy. The people who do best in psychotherapy have the capacity to reflect. And so those that do not benefit from therapy as much. And of course, then they're the ones who need it more. So there is a bit of a chicken and egg here issue of some people engaging and using wellness strategies to help their resilience. And it's partly because they have some of that resilience to begin with. But it's more than that. It's good relationships and social supports. It's being able to tolerate uncertainty. And again, those are things that can be taught, and cognitive behavioral therapy works, and some of the techniques of CBT are useful in helping people think about how to cope better and be self-critical and insightful about one's limitations and errors. So next slide. But, again, some of the things that you can talk to your patients about, and what we know of, and again, this could be a whole talk itself, right? The intersection and interactions between healthy physical habits and mental well-being. There's lots of research that has demonstrated how physical habits, exercise, of course, are good for your physical body, but they're really good for your mind. Reductions in depression and anxiety, but more importantly than just, again, getting away from the disorders, promoting feeling of calmness, feeling of being able to focus, so we know now that exercise and good, healthy physical habits really impact cognition, mood, and your emotions. So there's really good reasons to do those things, right? They're going to help you be able to be more resilient and cope better. Taking time for yourself. We are all in our world. I think the question from Joanna and at the beginning, we're waiting for everyone to get on. How's life going for you? Are you busy or as busy? It's always busy, right? We're always busy, but making sure even when we're busy, Dr. Pong brought up a good point. Hopefully it's good busy, right? So making sure you're balancing out the healthy busy from the unhealthy busy, but taking time for yourself is important. We always need to do that. Try to be flexible in looking at things. And sometimes you need to do that intentionally. For some, this comes more easily than others, but looking at problems from different angles, trying to understand different perspectives. It can really help us when we get worked up and are dealing with stress. It helps us cope. It helps ease that sense of distress and struggle that we may be experiencing. Practice gratitude, being grateful and taking those moments to appreciate when something or someone has done something good for you. And also, as I've talked about in the burnout talk before, and being grateful, for some of the things and recognizing when you've done good things, but really being able to be intentional about showing that gratitude and making that part of your life helps us build resilience. And then, these larger things that, again, get to what are the core meanings and purposes of life for you. If you really focus on what's there, you may shift how you approach things. It's the people who do not think about these things, who are just, in the hamster wheel, as they say in this country, or in the rat race, whatever your metaphor is. If you don't step back and reflect on meaning and purpose, it becomes very hard to feel resilient and well. And then, again, one thing that's going to continue in these last several slides as I talk about the factors that build resilience is there's a lot of overlap because these all interplay. So tap into your social connections. And of course, if you or your patients have mental health problems and substance use problems, get help with those, right? Those are things that really impact your resilience. Next slide. it seems obvious, but reduce stress. Very key to being well, right? And I'm not going to, like, obviously you can take away the things that, you can, but there are structural factors that and bring us stress, but be observant about those. Exercising regularly, again, coming back to it. So it's not just how does resilience come from physical exercise? Well, as I mentioned, exercising regularly brings a sense of calm and does reduce stress in individuals. And so, scheduling time for relaxing activities, sleep is another important one, and I'll talk more about that. Setting goals and priorities, helps us. We get really stressed if you're just thinking about the frenetic million things that I need to do. And so really try to focus those things, set your goals, not too many goals, 1, 2, 3 goals, priorities, and really try to focus on those. Again, hammer it home, social sport network, you need it, you need it, you need it. And then again, as I mentioned with the gratitude, show compassion for yourself. That's important, right? And when stress is too much, get help. That's you, that's your patients, right? Next slide. Sleep, we could talk about, and hopefully you have talked about sleep a lot more. I don't have the time to get into it, but really there's so much in terms of emotional wellness, mental wellness, and resilience and stress reduction that comes from quality sleep. So sticking to a sleep schedule, good sleep hygiene. Again, exercising helps our sleep, right? So you got to get that every day. Trying to avoid naps. And this is an issue. I assume it's not an issue for any of you, mid-afternoon naps, but your patients, this is important for them, right? They don't know necessarily what good sleep hygiene is. So these are practical things you can talk to your patients about that really help them get better sleep and fosters their wellness. Not the naps, nicotine and caffeine, avoid alcohol, large meals before bedtime, limit your electronics time, creating a good sleep environment, and don't lie in bed awake. All good qualities. There are good apps that help patients deal with these things too. So, and many of them are free, some are not, but there are free tools to help your patients sleep better. Next slide. Coping with loss is an important one, and it's really the thing that we see impacts resilience and wellness over time. It's the thing that chips away in older individuals where there's repeated losses. Obviously, for people who are experiencing, coming from, major societal disruptions that lead to loss, war, and other things, this can be very hard. But really, again, when you think about it, and this applies to you because you will lose patience. We've talked about this before, but taking care of yourself, talk with your caring friends. When you're dealing with loss, this is something important to talk to your patients, but certainly for you as well. No major changes to be decided at that moment when you're grieving. Really try to put those to the side until you're, in a better state. Grief support groups, they're in person nowadays. They're online to make it easier for people. They can be really helpful for your patients, for you if you need it. Sometimes people need more professional support, but be patient with yourself. Those are important qualities that help build wellness in you and help you cope with loss. Next slide. Mindfulness. This is important, something I took also from my prior talk, but it's paying attention in a particular way, on purpose, non-judgmentally, and in the present moment. Formal and informal, there's formal and informal mindfulness. Formal Qigong is an important technique. There are numerous studies now showing changes in areas of the brain in terms of the prefrontal cortex, the cingulate cortex, other areas of the brain that come from mindfulness. There certainly are studies showing how mindfulness can reduce stress and reduce symptoms of anxiety and depression. So mindfulness is really critical to, the emotionally well individual. So, there's not enough time to go into all of how mindfulness can be so important, but that these are both formal and informal ways to, get in touch with oneself and be able to be present in one's life. Next slide. So, again, some of the easier things that you can talk to your patients about are, deep breathing exercises have been shown to be very helpful in terms of relaxation, but helping people be more mindful. Walking has been shown to be very, and again, walking on one's own. Walking and talking with someone is nice, and that's important if you have those social times, but walking is really critical in terms of clearing the mind. Artists and writers have known this for centuries, but it's really, and there's more science around how that can really help, again, the mind soothe itself and be more present. Mindful eating is important for people who are overeating, and if you have patients that are doing that, or you're doing that when you're stressed out, we do it. We're all have been guilty of overeating or undereating. That's what anxiety does to us. It's important to then, really try to, practice being mindful about that. And when we talk about a body scan, we talk about, just really paying attention to your body from head to toe. That can do a lot to kind of center oneself, and really help us be more in tune. Next slide. I believe is last couple of slides. And so, what are the benefits we've mentioned? The improvement in anxiety, stress, depression, resting heart rate, and benefit to patients, obviously. That's to providers as well as patients, of course. But what you can talk to your patients about, and it's good for you too, improving communication skills, more positive emotional tone, and patients find that they feel more satisfied about their care when they're using mindfulness techniques. So I think my last slide is next. Yes, the thing that we've alluded to many times, but again, it's a central component as we understand the mind-body connection much better. But that you really can mitigate stress. There is decrease in what we think of as emotional exhaustion from people who exercise. It does promote healthier sleep. There's consistent counseling about exercise with patients is really helpful. There are numerous studies now showing how Tai Chi helps with a number of emotional factors and risk factors for depression and anxiety, and reduces depression and anxiety. So these are important things to be aware of. And again, just 30 minutes a day can do a lot to help you and your patients. And I believe that is my final slide. So I will say thank you for your time and patience with me and listening. And I am very happy to answer any questions at this time. So thank you.
Wow, that was a lot to unpack there. I don't even know where to start. I think since this is an Asian audience, right? And I think we experience our patients in different dimensions, right? Most Asians in the United States, including South Asians, East Asians, all Asians, are majority immigrants, right? So, something about being an immigrant already means you're somewhat, resourceful. You got here, you're healthy enough to get here, and that sort of gives you like insulation to some of this, but doesn't protect you completely. Then you're exposed to all those other things, the new country, generation gap with your kids, your grandkids. So there's a lot going on in there, but people express themselves in different ways. They may not have the same models of mental health that we do. How do you bridge those? Because you deal with many other cultures. How do you bridge those kind of gaps where they may not see it as either essential to their health or as mental health per se. How do you make it more universal?
Yeah, no, that's a great question. And I think it gets at that issue of the overall thing that I'm getting at here, which is focusing more, not so much on clinical disorders, right? Because I mean, I think very much, I mean, that's just a problem, and it's sometimes a non-starter in virtually any culture that we deal with. But in many immigrant cultures, um, the idea of trying to label someone with a disorder becomes contentious and problematic. So being able to focus on, and really listening, I would say it's the most important thing. I think you asked a question earlier about, to the group, what is it that, keeps you up at night? What are the things that bother you? Do you see disruptions in your sleep? Just their functioning and allowing them to come up with the words. We had a South Asian clinic at Bellevue when I was in training, a supervisor I had who was Bangladeshi had set up the clinic, and mental health conditions were just not part of the language, right? So there was no words for sadness. I mean, there's sadness, but depression, anxiety, right? It's like they weren't talking. They were saying, my head hurts, right? My stomach hurts. I can't sleep. And, I don't need them to, they don't have to fit with my labels, right? Whatever the words are that works for you and that is meaningful, you have at least a fighting chance of engaging them around things that they can do. And most of the things I'm talking about, don't involve pharmacotherapy. We're not talking about medications. I mean, the medications are needed for when they're needed, but so much of what we can do don't require, someone to pop a pill. It really is about, can you let's think about healthier lifestyles and helping you cope and again, manage the stress.
Yeah, I don't think we're well trained for that.
No, we haven't trained people for that. I'm spending time training community organizations and lay people about doing these things. But of course, I realize none of us have been, I mean, other than the mental health professionals, most providers don't get any training around how to do that.
I open up to questions from the group because these are all, I see people's names and they all have different interests and different experiences, and some are very experienced and busy clinicians. And, if you guys have questions, I see Benjamin Peng wrote, given the patient's limited time during patient visits, additional strategies such as translated messaging that can be given to patients and posted around the office and training staff to promote wellness is very helpful too.
Yes. Yes, no, I agree. Resources to hand to them are important. I know, I think that's absolutely right. We don't often have time. So that gets to that very foundational level of like, look, I don't have time to talk with everyone. If they're coming to me saying I've got a problem, you might talk with them a little bit more, right? That might be a focus, but there are some basic foundational things in terms of providing information that we could do that might stimulate your patients to think about that, right? And start doing things themselves. They might just tell you about them when they come back and see you the next time. I think that's a great point.
Yeah. So Ben, Ben and Angela. Angela's one of our developmental pediatricians. Yeah, so I wonder if if there's like a campaign, we could create a campaign, right? Like, talk to your so-and-so or whatever, or have you felt this, or whatever it is, right? To destigmatize, right? Like, oh, yeah, I feel like that too. Or ever feel like you're can't sleep, or ever feel like things are out of control, or whatever you want to say, right? Maybe it stimulates a conversation, or you feel like your life is out of balance, or whatever terms you want to use, to stimulate conversation. And Cora writes that too. Cora, like one-on-one is critical. Having that time to listen to somebody.
Yeah.
Even I like your suggestion, repeating their words.
Yep.
Well, you have such trouble sleeping. That must be troublesome. Why do you think it is, or whatever, right? And get them out of like, give me a sleeping pill.
Right. Yeah. I mean, that's definitely, we all know not the solution that works well. And it, and I think that for patients to understand that we're not just talking about, we're not medicalizing things. But I will say another important resource where I've mentioned community resources at times is, there is there's a good thing and a challenging thing about being physicians, right? I think people are more comfortable talking with someone who is, seen as, one of them. And again, if it's a community person who's trusted and helps them in their social life, who can say, hey, right, like the same things we were just saying about, stress or you're not sleeping well, they listen to community people a lot more. It's why the community health worker model is very effective.
And educating their friends. It seems like friends is always like, my friend said this.
Oh, yes.
And senior centers actually, are quite helpful, right? So socialization, fellowship, companionship, seeing people, getting people out of the house. I think there's a hidden power in that too, that we don't necessarily appreciate for either other community institutions, whatever it is, your church, temple, mosque, senior center, Domino's Club, whatever it is, right? Just getting together with other people, getting yourself out of your own place, right?
And
Get
Terry, I
out.
want to say something. It's Cora here.
Yeah.
Yeah. Can you hear me?
Yeah,
Yeah.
go ahead, Cora. Thank you
Cora
for
here. Yeah. I want to say something because I think the literacy is very important. Like the language, how to express ourselves, like the doctor said earlier. Or all I know to say is, oh, I'm very sad. I just feel sad. It's sad. There's no language. There's no variety. There's no even I read, I don't have the expression. So when circumstances happen, it's very hard to express ourselves. Then you, a friend, oh, you want to talk, but talk about what, right? Oh, Dr. Pong. So what? We don't have the language. So if there's any way, maybe we can develop some kind, like you just said, oh, have you talked to your friend? Ask 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, A, B, C, D, E, X, Y, Z, all sorts of scenarios. Then maybe I learn a few phrases from what we can develop. Not a handbook, but I would love to have a handbook. If say, oh, my mother just died, silence. Like, what am I supposed to say? Should I say something, not say something? Or, oh, my brother just was told he had cancer. But how do we respond? We don't have the language. And even the patient, like I am a patient too. It just pain. I don't know how to say it. I mean, there's a language for pain, right? How the picture, how much pain do you have with the smiling face, 1 to 10? So what about this mental health language? Is there some kind of handbook already developed? Then we can translate. I mean, learn something and modify it, or we can start working on something. It's like how can we make a response? What would be various ways of saying something on circumstances? Something like that. Back to you.
No, that's all really wonderful comments and questions, and I think it's a couple. I'll address a couple of the things there, which is one is right. We don't get trained as providers on how to listen and talk with, and often the thing we learn in the mental health world is often it is more listening than talking. Though there are key phrases, and I think, Dr. Fong, you mentioned like one, it's really being able to repeat and reflect back what you're hearing and shows, our patients that they've been heard and that you understand what they're saying. So I think, one of the things we deal with loss and struggles is that we think that we have we should say something that's going to, make it better. And nothing, you don't have to actually do that. What they really value in those moments is someone's hearing me, if they, and giving them the space to say, I understand this is hard, and I want to listen. Now, as a primary care provider, I know that's hard because you guys are dealing with such time crunches, but it's a real thing that if you can listen and reflect back what you're hearing, it goes a long way. But I think you're bringing up a much broader issue, which is the language issue, of if our patients don't have the language, and our communities don't have the language, how do we have a discussion or a conversation? And I think there, sadly, there can never be a handbook. It's multiple handbooks that are going to have to reflect those cultural and social factors, that every different community has their own ways of expressing and experiencing things. And we need to make sure that we have things that are not just translations of the handbook so much as really multiple different ways of communicating in ways that are authentic in the languages and cultures that we're working with.
There's some universals, like when you see people in the street have psychosis, it could be in any language. They have psychosis, right? They're just
Yes.
talking to whoever, But, when you talk about other language, I think Cora is very good, right? About that. Like, there may not be the words, right? But I think there's the expressions, right? Of, whether it's a facial expression or just a touch. Like when you see a person in need, right? Maybe you can't, I think especially as doctors, you guys want to fix things, or, get you out or fix things in 5 minutes or something. But, sometimes you just can't fix anything, right? It's just like, you can't fix that, but at least be there. Like, and even as a friend, like, so I think, or like when people can universalize, like, hey, that must have been really hard for you. Or, how long were you guys married? Or, wow, that's really hard. Or loss of a child, that I can't imagine that, or whatever it is, right? It's just like, hey, I just want to, I don't know what to say. You could even say that or whatever, but I just want to be here for you because I care about you or something, right? Just any expression could open up avenues, and later on, maybe not now, tomorrow, later on, like just knowing people, I mean, people knowing that you're being supported, right? I mean, I think
Yeah.
that goes a long way.
And you doctors ask, it really means a lot to patients. If you doctors showed that you actually notice, oh, something wrong with Cora, let me ask her on a personal level way, instead of just like the health wise,
Yeah.
those problems that it's like the person.
And we're human beings first, doctors,
Right.
That's very
clinicians
right.
second, right?
He
Yep.
He's a doctor who, very quickly, he's a primary care doctor, but he felt like something's wrong. There's something going on with these patients. He's not he's not a psychiatrist, those, but like in that visit, during the visit, he actually noticed something. But the patient hesitated to speak as well. So at the end of the visit, okay, so I see you in 3 weeks, right, or 3 months. Um, he really felt something's not right. So he actually walked towards her and say, "Hey, are you all right? Is there something not okay?" And that patient actually started speaking. So he gave her an extra 10, 15, 20 minutes. And he also offered, like, if you want to, tell me more next week, you're welcome to come back. And actually, he spent time. He saw her like 4 weeks, in 4 weeks' time. And she unloaded a lot. He didn't need to write any drug medication for her. And it was very meaningful for the doctor, as it turned
Yeah.
out. He shared
No,
that. Back to you. Sorry.
that is a beautiful story, and that is really, the heart of what I'm, hoping to help you all think about, which is right. It's these, they may not seem like huge things, but even just that paying attention, as you described, observing and seeing, and just saying, I see it. If you want to talk, I'm here. it can mean so much to our patients, but I will also argue from a broader level that we do those kind of things individually. Maybe that person never developed something down the road, but I can tell you, having seen the people who never got asked those questions, who sat on it for years, and then they end up, in an ER, in a mental health professional's office because they've developed things, and no one really took the time to ever try to address what was the thing that was eating at them.
Wow.
Thanks,
Yeah.
Cora.
Yeah.
I think one other point I just want to make, because we have clinicians and other healthcare professionals here, is like about taking care of yourself as a perspective. It's hard being a clinician. I feel like I'm a puppet of the insurance company
Oh,
10% of the time, maybe the EMR 20% of the time, maybe something else, because you don't have you lose autonomy, because you're not in control of your schedule. People come in, they're sick, you just got to take care of them, right? And that's what you're trained to do. So it's hard being a clinician, recognizing that for everybody and giving themselves space and your colleagues and giving them a pat in the back really helps. So when you have if you ever have a chance to say something good about somebody, go ahead.
yeah.
If you have kids, make sure you
Yes.
catch them, right? So if I say, hey, Ben, thanks for taking care of Mr. So-and-so, it really helped him, or whatever, right? It really just that one sentence or two sentences or line or whatever you do,
Yeah.
encourage each other, because it's hard now. And,
Yeah.
I see the other people here, and we are a community, and we want to help each other, and in some meaningful way, like things like this, but also in other ways, whether it's social or helping each other when we are in need, because we're all in this together. We're all the same reasons. You want to help patients, people, the community, and you know
Yep.
we want to support each other and recognize it's hard,
Yeah.
especially in this environment now.
Yeah.
Anything other people want to say, Jonathan or Robert or Jamie Johnson, James, Eliza, anything that you guys want to mention? You're so healthy, you're so good, you're so balanced. How do you do it? I don't know. Give us some tips.
Oh, that's another thing. Everyone seemed so happy when I started talking. Actually, everyone has something to tell me that they are in a terrible situation. I was oh, it's so sad. Everyone is encountering something very difficult. So how can we cheer ourselves up? It's just like everyone appears to be in a
Yeah.
perfect condition. And then
Well, one thing that I learned, I forgot what management book I was reading. I love those little self-help management books. But one of them was like, when you talk to someone that you supervise, and instead of like, what's going on, just like, what's on your mind, or what are you thinking about, is a way to make someone sum up what they're thinking about, and sort of make them crystallize or think about it. And you could do that with patients too, or even your own friends or staff. Like, what do you guys think? What are you thinking about? Instead of like, wow, you see this in the news? Oh my God, it's just more like, well, what do because everybody has different things on their plate.
Yeah.
Yep.
And that might be one way to just open up a conversation.
Absolutely.
Yeah.
Okay. Well, we're almost at the end. So anybody have anything else that they want to mention, share, tips, anything, life tips? I don't know.
Exercise.
I'll give
Now I'm really into it. Like,
I'll give Dr. Malavade the last words.
Well, look, I really appreciate this conversation. I think, you have touched on a number of really important things. And I think most importantly, it's acknowledging how hard our work is and how this is important for us, right? It's not just good for our patients. We can't be good providers if we don't take care of ourselves. So certainly encourage you to, I think you've all brought up a number of good points too about what would be helpful for not only you, each of you, but your patients. And appreciate the time with you. And I think you all how to reach me, and so the CAMS and Health First team know how to reach me. If I can be of any help in thinking through some of these issues, I'm always happy to, and happy to brainstorm with you all about how we can do better for our communities and our patients. So thank you for your time.
Okay, thank you.
All right.
So much.
Okay, thank
Yep.
you.
Thank you. Have a good night, everyone.
Good night, everybody.
Good night.
Remember to fill out your CME so that you get credit.
That's right. I'll send out an email to everyone. Thank you for joining.
Okay,
Awesome. Thank
good
you.
night.
Good night.
Thanks, Dr.